Labrīt, cienījamie konferences dalībnieki!
Good morning, dear participants and guests. Today, it is my pleasure at the National Library to host guests from all the member states to discuss the most topical issues in view of the reforming of social care policy. Today we have got interpretation in two languages, into Latvian and into English. Please remember that during the work groups, the working language is English and there'll be no interpretation into Latvian. Today we also have, this conference is online. At present, it is my pleasure to give the floor to Mr. Uldis Augls, Minister of Welfare of Latvia.
Dear ladies and gentlemen, I have a great honor to open the conference, The Institutionalization, Practices and Further Development of Social Care. The conference forms a part of the events organized within the Latvian presidency, where the situation is analyzed at the EU level and the willingness to improve the quality of life for persons with disabilities and their social integration is strengthened. I would like to especially emphasize that the first high-level meeting on disabilities was held in Riga on the 11th to 12th of May. I am pleased that we have the opportunity to continue the discussion started at the expert level today, focusing on the institutionalization in particular. Today's conference has been organized with the support of the EFA and Norwegian Financial Instrument. Thus, I would like to use this opportunity to thank the Ambassador of the Norwegian Kingdom in Latvia, Mr. Hagen, for the support and cooperation provided by the Embassy. The involvement of the Norwegian Embassy in the organization of the conference proves that discussions on social inclusion and high-quality social services are also important for other European countries. All people, regardless of their state of health, social status, and origin, have equal rights to be included in the society, enjoying the same freedom as everyone else. However, not all people with disabilities are able to take care of themselves, independently defend their interests, and get involved in employment and community-related activities. People with serious disabilities and children having no parents face the risks of helplessness. This is also the group of individuals that most often becomes the users of the institutionalized care. The spectrum of social services, as well as their content and quality, differs from one country to another, and yet more than 1 million Europeans reside in care institutions. Unfortunately, the services provided by the institutions have certain disadvantages, including limited possibilities to form individual care programs, because the daily activities are organized sticking to a fixed schedule. Life in such conditions often creates indifference toward the surrounding world, low motivation, and a lack of belief that the person may accomplish certain things themselves. Europe is determinedly moving toward creating a society and environment that would be friendly to every individual. In general, countries have a consensus that by providing quality community-based services and general accessibility of services, people with disabilities need to be given the right of choice and control over how, where, and with who to live with. Meanwhile, it is crucial to provide family care to orphans and children who have no parental care, if necessary in a guardian or foster family. It is essential in order to prevent deforming the child's perception of family, its establishment, the role of parents, and upbringing. The demographic trends of the past years, as well as the consequences of the financial crisis, represent a serious challenge for European economies. Thus, alongside the improvement of the accessibility of services and their diversification, the countries are looking for ways of reducing costs. It is challenging to find the way to do it without reducing the quality of services, ensuring instead that the services are effective and have long-term results. New solutions are sought and new working methods are being developed. It is most important to create a safe environment that would correspond to people's interests in order to reduce the risk of institutionalization. European countries have different social policy priorities. Nevertheless, many of them pay big attention to the development of social care policy and the institutionalization in particular. This conference will be an opportunity to European countries to share their experience and learn something, so that we, each in our country and in Europe in general, could improve the quality of life of people with disabilities. I'm convinced that the participants of the conference will be able to find common aspects of work and gain ideas for better future solutions in order to make each country safer and friendlier to children having no parental care and people with disabilities. I would like to thank in advance all speakers for having found the possibility to participate in the conference and enrich discussions with your experience and knowledge. I would also like to thank all conference participants for the willingness to get actively involved in pursuing the objectives set, looking for the most successful solutions to improve the quality of life for those who face social risks. I wish you all an enriching and productive day. Thank you.
Paldies ministra kungam par iedvesmu.
Thank you, Mr. Minister, for inspiring words. They are not just words, but also real action for the past years. We are convinced about the need of deinstitutionalization, developing the concept of the family. Amendments have been given to an amendment bill has been passed on to the Parliament. Thank you. Therefore, today's work has great importance. Thank you, Minister, once again. Now I have the honor to give the floor to the Ambassador of Norway to Latvia, Mr. Steinar Egil Hagen. Norway has been cooperating with Latvia for some time, and as mentioned before, this conference has been organized with the support of the European Economic Zone and Norwegian Financial Instrument. Please, the floor is yours.
Minister, distinguished guests, ladies and gentlemen, it gives me great pleasure to participate here at the opening of the conference on the institutionalization practices and further development of social care policy in Europe. This conference is part of the official program of Latvia's presidency of the Council of the European Union. As many of you may or may not know, Norway is not a member of the EU. However, through the agreement with the EU on the European Economic Area, Norway, as well as the other signatory countries, Iceland and Liechtenstein, are more or less equal partners in the internal market on the same term as the EU member states. This includes having access to the internal markets, free movements of goods, persons, services, and capital. In addition, the agreement covers cooperation in other important areas such as research and development, education, and social policy. The topic on the agenda here today is therefore also an important area for Norway and where we see cooperation with other European countries, as also the Minister mentioned. That explains why Norway supports this conference through the EEA Norway grants, not only financially, but also by having two of our experts here today, sitting on the front page, who will share Norwegian experiences with you here today. Due to globalization and increased migration, many families and individuals live in other countries than their own and come into contact with health services and social services in a country other than their own. Norwegian policy is that the use of institutions should be minimalized. If, for instance, a child cannot for a period live together with its biological parents, alternatives in either foster families or in the network of the child should preferably be identified. Only where intensive care is needed and in exceptional cases is institutions seen as an alternative. According to a recent Council of Europe report, Norway is on the low range of countries with respect to the number of children in institutions and foster care. We are not among the highest, we are among the lowest. There is a high threshold for passing a care order in my country. We appreciate that these and other issues relating to the questions of deinstitutionalization varies from country to country, and therefore welcome the opportunity that this conference organized by the Latvian EU presidency and the Ministry of Welfare give an opportunity on exchanging experiences and hopeful to learn from each other. We wish all of you a useful and successful conference, and we are pleased and honored to be part of it. Thank you.
Paldies vēstniekungam, vēlreiz liels paldies par.
Thank you very much, Mr. Ambassador. Thank you for your support. And now I would like to give the floor to Mr. Jerzy Schwarz from the European Commission, because the European Commission exactly was the institution that confirmed the plan for deinstitutionalization and who worked out the guidelines, and I'm happy to see Mr. Jerzy Schwarz, who is a member of this team, and this will give a new push to this document that is 10 years old already. I believe that Mr. Jerzy Schwarz will introduce us to this document. Over to you, please.
Good morning, Labdien. Thank you for the opportunity to be able to speak to you at this event. To correct you, I'm not personally involved in the development of the guidelines, and for that the credits have to go to the European Expert Group, which is certainly supported by the European Commission. First of all, I wanted to thank you, the Latvian presidency, for organizing this event. I think it's very important to opportunity and possibility to put such a key issue on the agenda and sort of keep the momentum. I will say a few points from our perspective, from the perspective of the sort of the policy level as well as the funding perspective. Why the institutionalization? I'll be very brief because I think I would be preaching to the convinced. But what I wanted to say at the beginning is that it's not only about the political and legal commitments. It's not only about the UN Convention as such, but about the whole concept of approach to human rights in the European space. And improving quality of life as such for those who are in many cases excluded from our societies. I think it's also important to keep in mind the economic arguments, where if we bring in the cost of the institutional care into account and its quality, then the investment in the prevention and the community-based care certainly brings better results in terms of outcome. But this is something that you probably are aware of. What I wanted to say at the beginning is that a lot of policy documents have been written, guidelines have been created, and I will speak about that. I'll speak about that later. But what is important is to be able to tell stories and to tell success stories, especially. And I believe that it's essential to be able to tell stories to the public, to our ministries of finance, to our political masters, to show that the process is something worthwhile and can bring substantial results. One of the stories that I am aware of is a story of Vyšší Hradec, which is a place in the Czech Republic, 18th century castle, and you can read on the slides how it looked in 2006, which is not that far from now, only 9 years ago. 90 women in isolation rooms, cage beds, locked doors, strict regime, incapacitation of the clients, and many of the clients actually never crossed the doorstep of the institutions alive. 9 years later, due to enlightened director of the institution, what we see is that the building is closed. All the clients left the institutions and are living individually or in small homes, in rented apartments. Only very few of them left for other institutions for different reasons. The former staff, or at least half of it, works in the provision of community-based services. Most clients have their legal capacity back and even are employed. And this is a story that needs to be told and repeated to be able to show what the institutionalization actually means apart from political commitments and legal obligations. But back to the policy level, which is something that enables such stories to happen. I will not speak about the UN Convention. I think this is something you're all familiar with. I may only remind of the existence of the European Disability Strategy, which runs to 2020 and sets the agenda on the EU level to implement the EU Convention. And it within that strategy, the EU sort of tries to bring about the coordinated actions to make the commitments in the Convention reality. They address the issues that are mentioned in the slides, including employment, education, training, social protection, health issues. It needs to be said that it's a shared responsibility. There is only so much that can be done at EU level. The responsibility for delivering and for making sure that the convention is applied on the ground mainly lies with the member states who are running or not running or trying not to run the institutions that we are talking about today. There was a high-level group on disability a few weeks ago, which was already mentioned. On the European Commission level, we also have a so-called inter-service group on disability, which aims to mainstream the disability issues into EC initiatives, and it looks at EC initiatives to make sure that the commitments are respected. and it also attempts to raise the awareness of the convention among staff, which is also an important part of its work. You probably are aware that the European Union is now reviewed by the UN Committee concerning the implementation of the convention, and we expect the dialogue to happen in August and to see the recommendations in September. I should also mention the sort of one important aspect of EU legislation making, and this is impact assessment. This is a very complex and unfortunately sometimes quite long process, which looks at potential impact of proposed policy measures or legislation. And what is important is that disability and the convention commitments are also examined during the impact assessments. Another piece of policy guidance came in 2013, 2 years ago, and that's the recommendation, or European Commission recommendation on investing in children, which promotes the deinstitutionalization measures among others. You can read on the slides the extract from the document, which very well coincides with what has been said already, and what will be, I'm sure, discussed later on today. Europe 2020 strategy is our long-term 10-year strategic document for a process for smart, sustainable and inclusive growth. And I think it's important that we have managed to, even during the crisis time, we have managed to keep the inclusive part to be part of the process. There have been a number of recommendations to many countries in the employment and social inclusion area, and there have even been some on DI as such. What is part of the process is also the national reform programs, which are tabled by the member states. And you can see that there are some who mention directly the institutionalization in their own strategies. So this is also important commitment. The European Expert Group has been mentioned, established in 2009, and it has been supported by the European Commission, and as it was mentioned, one of its key outcomes was the guidelines and toolkit on transition to community-based care, which is translated to a number of languages. I think Latvian is still to come, but hopefully it's a matter of logistics and nothing else. And these guidelines have become, on the EU level, as some sort of, I would say, informal constitution of the deinstitutionalization process. And this is something that we have been trying to promote. We have been promoting that also in the context of negotiations for the current round of EU funds spending. Some member states commit to their implementation in their programming documents. So this is a very important piece of guidance that also aims to sort of explain and publicize the nuts and bolts of the institutionalization process. I think we will also probably hear today about the opinion that was published by the European Economic and Social Committee a few weeks ago, and I have picked up on the slides only a few bullet points. There is much more in the opinion. It also points to the austerity, which in a number of cases have resulted in reduced budget for services, and it also notes that there is some trend towards institutionalization in some member states. It also acknowledges all the long-term political strategies and also calls for a European quality framework regarding the community-based services. I can also mention the work that is being done by the EU Fundamental Rights Agency, which started a research and data collection project to develop indicators for the right to independent living. So we eagerly looking forward what will come out of this project, because it's very important to have evidence-based policies. And any Europe-wide or independent research and data collection is very much welcome to make sure that we can demonstrate and we can back our decision making by hard data and justify it to the public, to the political level as well. A few words about the European structural and investment funds in the current period. I think this is probably the first time when the deinstitutionalization as such is part of the legal framework. The European funds or the structural funds in the past were criticized for funding the institutions rather than the institutionalization. So now with the new round, we are certainly paying much closer attention to the process. We have been putting the DI on the agenda of the negotiations with many of the member states. There is within the structural funds there is sort of new instrument which is called ex-ante conditionality, which basically says that you should not put any money into areas which are not covered by a sound national strategies. And the conditionalities also say what these strategies should be. And there is one of them that is aimed to tackle the poverty, and this one has to include measures for the shift from institutional to community-based care. So this is something compulsory. There's also another ex-ante conditionality for the use of the funds, and that directly refers to the UN Convention and calls for administrative capacity for its implementation in the member states. So it's also a very important part of it. And there are a number of references in the regulatory framework where you will see the transition from institutional and community-based care. Some of them are listed on the slide. This funding period, we have something that's called investment priorities, which are directly trying to define what should be, what kind of measures should be funded under those headings. And there are also some that are directly or less directly supporting the institutionalization. You can read them. You can read them on the slides. As a matter of principle, what we have been trying to do during the negotiations is to make sure that there are no measures which would contribute to institutionalization. Nothing like that should be supported from the EU funds. DI is an explicit priority in a number of partnership agreements, that's the abbreviation, and operational programs. Baltic states, in particularly Bulgaria, Romania, Hungary, Poland. This is also the countries where the EU funds form a big part of their national spending in this area and social inclusion as such. There's also a partnership principle which has a prominent role in the implementation of the EU funds. There is a piece of legislation even which is called the European Conduct on Partnership, and it requires the member states to involve all the relevant stakeholders in the monitoring and implementation of the funding, and we have seen members of NGOs also from the sort of the institutionalization sphere being members in the monitoring committee of various operational programs. Last message I want to give, and I'll be happy if this is something that you can remember from my presentation, is the need for a holistic approach to the institutionalization. And I try to structure it in the four areas, and I'll try to explain a bit more. Availability of the community-based services is an absolute precondition for any sort of the institutionalization activities. I think we have all concluded, especially from the perspective of the EU funding and other experience, that investment in the new housing infrastructure alone will not lead to the institutionalization. Quality assurance, minimum standards is something that certainly should come along with the building up of the community-based services. Gatekeeping. This is something that I personally am missing a bit from the debates that are ongoing on the EU level or on the level between member states. This is something that has an outreach to other policy areas, because gatekeeping needs to be approached from the health policy issues, from the employment activation, also wide availability of the community services as such. Support to family-based care when the separation from the family certainly should be the measure of last resort. We have seen in some places the sort of the moratorium on admissions, which hopefully will bring the desired effects. But gatekeeping is something that I believe we should pay a particular attention to when looking at the institutionalization as such. Focus on individual needs and capabilities. There is no one solution that fits all, but this is probably something that you are all aware, and it doesn't need to be explored further. I believe needs to be also put on the table is the fact that DI is a reform process. It's not a business as usual, and every reform process needs a continuous political commitment and involvement of the stakeholders. Without continued political support, it's very difficult to make changes, and I'm sure many of you know very well. I think part of that is also a debate on how best use the available public funding, where it actually brings more long-term results in terms of quality of life and inclusion. And last but not least is the stakeholder sort of commitment, support of the staff of the institutions, management of the institutions to the whole DI process, which is crucial at the end of the day. Thank you for your attention. I want to finish with the note that we have tools and funding available in most cases. And now, especially with the new rounds of EU funds, which for some countries are substantial, for some less substantial, but this can give a new sort of impetus to the process. And it's a unique opportunity to take advantage of the policy guidance, of the legal commitments, and of the fundings at the same time. And we have been discussing with a number of countries, including Latvia, on the way to de-institutionalize, and I have a good feeling that there is a commitment, and there is a very good basis for progress, and this event is an example of that. And I appreciate this commitment of the Latvian authorities also. Because they organized this event. It's basically now time to move from the guidance and policy level to the implementation, to the concrete projects and stories, and this is what I hope we are all aiming at. Thank you very much. Paldies.
Thank you, Mr. Švarcs, for appreciating Latvian efforts. We have indeed done a lot of initial work for the DI process to be successful. And as I mentioned previously, the aim of this conference is to gain an inspiration and see some examples of how this could be better done. I thank the honored guests, participants, speakers of this first part. You may take seats in the hall.